Hello, friends, and welcome back to another episode of PSA for Black Men, prostate cancer. I'm going to make this fairly quick, but it's a fairly important uh, episode because I am in the middle of the radiation treatment. If you remember from previous episodes, the prostate was removed, but there was a spot of cancer identified on my hip, on the bone. So it's a very, very small spot apparently, and I was scheduled with the UCLA Medical Clinic for the radiation group for 3 sessions. I am actually going in today for my 3rd session. They were almost right in a row. I had one on Friday, and then we had a long weekend, and I had the second one on Tuesday, yesterday, and the 3rd one is today, Wednesday. And I'm just praying to the universe, to God, to anyone who's listening, that that's all there will be. Now, of course, we know that cancer is one of those lifelong things, and so I will continuously be checking over the months and years, and hopefully it will just remain dormant, if you will, because I don't believe it ever quite goes away. Whatever brought it on to begin with is still somewhere there inside. So we're just going to be careful going forward. The radiation treatment, let me just talk to you about that for a second. There's this big machine that you lay down on. It looks almost like the PET scan or the CT scan type machine, but it's not enclosed like that machine is. I don't know if you're familiar with that one. But it's very similar, and it's wide open. I'll try to show you a picture here if I can insert a picture or video here of that, and you'll see that it's this big thing that sits on top of you, hovers over you, and then it starts to rotate around you as you're laying down. You're laying down, and it's up here, and it's just rotating around you. I would imagine it's firing lasers or radiation into whatever area that they've marked. Now, they have marked a couple of spots on my body. The first step to this whole radiation issue was to get what they call a mapping. And the mapping, they take you through a CT scan like this, and then they identify specifically where they want to hit and target this radiation. And that mapping resulted in 3 X's that were literally written on my body with a magic marker. And then they put tape over that, a clear tape over those markings, so those markings don't go away. And so you can kind of shower, but you can't bathe with that tape on. And then after that, you go in for your radiation, which I've been doing this last few days. So with that said, I am in the 3rd leg of this 3-session process, and in doing this, I will tell you my side effects have been very minimal. Now, I also will say that the technician that was doing the work indicated to me that these are very short sessions, possibly because the spot is so very small. These are very short sessions. In fact, he wanted me to come in 20 minutes earlier today so that I could get it done and out of the way, and he could fit somebody in on the schedule. In the waiting room, you see all these people. It's amazing how many people are getting some kind of treatment from either radiation or some level of treatment. But mine are fairly quick, and he also said that the 3 sessions are very short in terms of the number of sessions. You have some people that are in there for 30 and 45 sessions. And so I am so very grateful, so very thankful that this is 3 short sessions. And again, hopefully this will nail it completely, or as complete as possible. They also ask what kind of music I would like to listen to while this is happening. It takes about 20 minutes, and we're done. And so of course I pick R&B and Luther Vandross, and they play the music while I lay there and have this done. But they're very short sessions, and there's been no side effects as of yet. I thought I felt a little bit of warmness on the hip, but they said, no, that's not even where we did it. So I think it was all in my head. And so maybe over the next week or so, I might feel a little residual from it. I don't know. Also, we'll just back up. My voice is still a little bit cracky because if you remember from the last video, I had COVID. I had gotten over COVID, and a week or two later, I got hit with this terrible sinus. I won't even call it an infection. It's just this cough and this sinus clog, and I've been dealing with that for the last week. Gone into the doctor. He's given me everything for symptoms and even some antibiotics just in case it is an infection. So I mean, it's more irritating than anything else. It's not a problem, but it just seems like there's one thing after the other. But the good news is I'm still able to go through the radiation treatment. That's happening now, and I think that's it for now. See if I left out anything very important. I've had to basically stay at this hotel for the last few days because of the treatment has to be done in successive days. So I've been fortunate enough to drive into LA and have the time to stay at a beautiful hotel. For me, it's all about comfort and convenience, and this hotel is literally walking distance to the UCLA Medical Clinic. So very convenient, very comfortable, and when you're going through this, why not, right? So hopefully I won't have to ever do this again. Anyway, that's it for now. Hope you're having a great day. If you get to this point in your journey where you are seeking radiation, I will tell you this is not the radiation that's in lieu of prostatectomy. This is a different radiation, okay? So the radiation that's in lieu of prostatectomy requires so much more. Hormone therapy, and it could last for 18 months, the hormone therapy. And there's probably many more sessions of radiation that have to happen, depending on the size of the cancer in your prostate. So this radiation is not quite the same. So I just want to make that clarification. All right, that's it for now. And if you're wondering about the hat, WAGGLE, it's a golf term. You stand over the ball and get ready to hit the ball. Most golfers have this little waggle in their hands and even in their butt before they strike the ball. So there's a company that puts these hats out. I love the hats. All right, we'll talk to you again next time, and maybe with some great news. I think this was great news today. All right, you take care. I'm doing well. I hope you are as well. All right, be thankful, be grateful, give when you can, and because you have this power to choose, love yourself first, then choose. Talk to you again soon. Take care.